There's a key question that you want to ask yourself as you're getting closer to the age of 65. And that is, are you planning on keeping your employer coverage or self-employment coverage? Or are you thinking about going on full Medicare or retiring? It's really going to depend on your answer to those two questions, how you're going to proceed once you get to the age of 65. So it's something good to start to think about maybe 6 months or so before you get to that age bracket. So to begin, what's the first option was what's employer coverage or your own insurance coverage, if you're planning on keeping that. Here's what you're going to want to do. Medicare is split up into two parts, Part A and Part B. Now, if you're going this route, meaning you're going to keep your employer coverage or your own coverage, and there's various reasons people may do this. Maybe it has better coverage, the premium's very low, or they have a spouse that they need to keep on it until they turn 65. But the important part here is that you're only going to want to sign up for Medicare Part A. You do not want to sign up for Medicare Part B. And here's why. Medicare Part A, as long as you've worked for 10 years or 40 quarters and you pay taxes, Medicare taxes on that money, there is no premium for Medicare Part A, meaning you do not have to pay anything, so there's no reason not to get it. Now, Medicare Part A is your hospital coverage. So to recap on that point, if you're self-employed, having your own insurance and maybe need to wait for a spouse to come on, or you currently have employer coverage and you're not planning on retiring yet, you'll want to only sign up for Medicare Part A. And you're given a 7-month window to do this. It's what's called your IEP, or your initial enrollment period. Now, the other side would be if you want to go on full Medicare, meaning that you will get both Part A and Part B. Now, in this side of the coin, you'll do exactly as we mentioned earlier. Part A will have no premium if you've worked for those 10 years or for 40 quarters. Now, Part B, on the other hand, in 2022, has a base premium of $170.10 per month that you do have to pay in order to make a decision on if you want to go on a Medicare Advantage plan or on a supplement plan. Now, keep in mind, this number can be higher depending on your income. So it's an important aspect that you want to look at as you get closer to 65 to see which level that you fall under, because the premiums can go up depending on your monthly income. Now, once you sign up for Medicare Part A and B, and again, this is going to be during your initial enrollment period, which is a 7-month window, 3 months before the month you turn 65, the month of, and then 3 months after. Now, once you're on that, you'll be able to make a decision for yourself. If you want to go with an MAPD, which is a Medicare Advantage prescription drug plan, or if you want to go the supplement route. And in order to do this, you'll also want a Part D on that area, as to avoid the Part D penalty for not signing up for it when you turn 65. Now, you do not have to worry about that Part D penalty on the side if you're going to hold off on Medicare, because what you're doing is you are deferring Part B, meaning that you're not going to sign up for Part B yet. And because your employer coverage, which you'll want to verify, is qualifying, meaning it's as good as Medicare or better, there will be no penalty for it. And same with your own self-employment coverage. So what will happen then in this scenario is when you only get your Part A, you'll defer Part B, and then when you're ready to retire or go on full Medicare, you'll then qualify to sign up as if you had just turned 65, meaning you will then make that Part B active. You'll pay that monthly premium just like on this side, except the difference will be that you'll be at a later stage in life versus on full Medicare when you turn 65. And it's important to have that, as that will allow you to avoid that Part D penalty. So just to recap, if you're staying on your employment coverage or your self-employment coverage due to having a spouse, you'll only want to sign up for Medicare Part A and defer Medicare Part B. It will not cost you anything as long as you've worked for 10 years or 40 quarters and paid Medicare taxes on that money. Then when you're ready to go on full Medicare, you'll sign up for Part B and you will not have a penalty due to having qualifying coverage ahead of time. And to recap on the other side, if you want to go on full Medicare, again, you'll want to sign up for Medicare Part A, which will have no monthly premium. However, you'll want to also sign up for Part B, and that starts in 2022 at $170.10 per month. Then once you get A and B, you can then decide if you want to go on a Medicare Advantage prescription drug plan or if you want to go the supplement route. So these are some important questions that you want to consider before you even start the Medicare process, if you're going to go on full Medicare or if you're going to defer it. And then this way you can make the best decisions for you, for your Medicare future, and for your health needs.